Hi, everyone. I'm Michael Lewin, and I'm the managing director and co-founder of Koe Koe Tech, a Myanmar-based IT social enterprise, and we make mHealth apps and SMS services for the Myanmar people. Myanmar does very, very poorly in health. I don't know what you know about Myanmar, but it just opened up to the world in July 2012. Myanmar is much more like North Korea than it is, other Southeast Asian countries. For reference, Singapore's per capita income is about $77,000, right? Myanmar's is about $1,000, right? So you can just extrapolate from that all sorts of problems Myanmar has, particularly in health, right? Among the worst in the world: maternal and child health, infectious disease, hypertension. Whom we are helping. We are helping 4.4 million pregnant women, 14 million children, 32 million suffering from infectious disease. That includes malaria, dengue, TB, HIV, AIDS, and 18 million suffering from diabetes and hypertension. 42% of the adult population has hypertension in Myanmar. How we help them. So we have lots of partners. There's a telco, Ooredoo. There's a global INGO called Population Services International. And Myanmar, one of the benefits of being late to the global scene is that people are buying smartphones in Myanmar. About 90% of phones are smartphones. Feature phones are very low. So we've created an app that sends 3 messages per week, starting with maternal and child health, to pregnant women and their partners, right? And now we're expanding that to include 32 general health categories covering all the populations I named earlier. And not only that, you can buy health products. Now, Myanmar suffers both from, there's a lot of low quality or fake drugs in rural areas. Not only that, there's a lot of doctors of low quality in rural areas. It's a really sad story. My co-founder and CTO, Yaza, he and his brother contracted hepatitis B. And it's an incurable disease, and it's because when they were living in a rural area, a doctor reused dirty needles. His mother has been diagnosed with hepatitis C for the same reason. Now, luckily, that's become curable just this past year. But these are kind of the situations people in Myanmar face. We are working with NGOs where there will be sales agents, and you can order products using the phone in rural areas, and they'll come and bring high-quality drugs to you. Not only that, we'll have telemedicine, where you can have teleconsultations with experienced urban doctor specialists who are franchisees of Population Services International quality training, so rural people know that they can get high-quality care, even if they're remotely located. More coverage, more impact. And the app has been received very, very well. And we measure social impact rigorously. We're working with development economists and universities conducting randomized controlled trials because we're a social enterprise. We have to hold ourselves accountable. And how will we distribute? People in Myanmar are not used to downloading apps. Telcos just launched in September 2014. They are used to having preloaded apps on their phones. So starting this month, 40,000 $29 smartphones distributed nationally. End of this year, 600,000 smartphones. This is how we can scale very, very quickly. And we fully intend to scale internationally. Right now, we're entering Indonesia in partnerships with Population Services International, GSMA, because they have 120% mobile penetration. And we intend to scale in the 65 countries PSI operates in and the 50 countries FHI 360 operates in. Thanks very much.